Welcome back to Your Health television program. I am Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so pleased you could be with me for this next segment. The segment today is called Hard Breast Implants Part 2. For those of you who tuned in to my last program, I started the very important discussion about this very common problem in plastic surgery, the hard or hardened breast implant called capsular contracture. What I'd like to do is present a recap of that part 1, and then we'll go on to present to you some additional information about the hard breast implant, or what we call capsular contracture. So it's very common for women, especially women who had breast implants many years ago, the older type of silicone breast implant, to experience what they can call hard breast implants. The technical term for that is called capsular contracture. Now, to recap, anytime we put a foreign material, a foreign body into the human body, whether it's a heart valve or a hip replacement, a breast implant, a knuckle replacement, anytime we put a foreign material into the body will make a scar around that implant. And that's normal, typical, and it's expected. For some reason, with breast implants, sometimes that capsule can become thick and heavy and contract, and that's called a capsular contracture. To recap again, there are 4 different grades of capsular contracture. Grade 1, everyone gets. As I said, everyone gets a scar that forms around the capsule, around the implant, whether it's a heart valve or a breast implant. That's a grade 1 capsule. Grade 2 is where the breasts look normal, but with touching, the breast feels different. It can feel hard. Grade 3 capsules describe when the breast implant or the breast starts to change the way it looks. And stage 4 capsular contracture is when there are actual constitutional symptoms. In other words, even without looking or feeling, a woman will oftentimes feel a discomfort or cold intolerance, or feel some squeezing in the breast around the implant. So that's the most severe capsular contracture, grade 4. So what's the cause of capsular contracture? We don't know for sure, but what we can say is that invariably that there is a chronic inflammation around the implant that will incite or cause that capsule or that scar to become thick and heavy and contract. So what are some of the possible reasons? Well, for the old silicone implants, or the implants, say, from 20 years ago or longer, there was oftentimes a phenomenon that we saw where there was a very slow silicone gel bleed or leak. In other words, it's not that the shell has ruptured or torn and there's a very rapid escape of the silicone gel, but there's a very slow bleed across the silicone membrane of the gel, and that free silicone outside of the shell incites an inflammatory process whereby the capsule becomes thick and heavy, where that normal scar becomes thick and heavy and contracts. What else can happen? As I started to describe in part 1 of the hard breast implant program or segment, there can be, in some instances, a bacterial contamination around the implant. Well, how does that happen? First of all, we all have staph all over our skin, staphylococcus. That's a normal bacteria all of us can find on our skin. It doesn't mean we're unhealthy or unclean. We all, 100% of us, have staph growing on our skin. And within the lobules and within the ducts of the breast, there can be staph, because those ducts are connected through the nipple to the outside world and to the skin. So staph can get inside. If some of those staph can get on the breast implant, they can colonize the breast implant. In other words, they can live there just like the staph live on the skin. It doesn't mean there's an infection. And oftentimes a culture will be negative, and it takes a very sophisticated workup or tests to even find some of the bacteria that may be colonizing or on a breast implant, or any other type of implant for that matter. The same type of biofilm can occur on a cardiac valve or on a hip replacement on the prosthesis. The bacteria can just sort of be there on the surface of a breast implant and not really cause an infection, but it can cause an inflammatory process. So, once a capsular contracture occurs, what do we do about it? First of all, with a capsular contracture, we want to make sure that there's nothing else going on in the breast. Oftentimes, a woman needs a mammogram or an MRI to work up the breast tissue to see if there are any enlarged nodes, to try to get an idea if there's silicone extravasation far away, or is it just limited to the implant and to the capsule itself. So most women, of course, with breast implants, we encourage them to be doing self-breast exams and to be getting regular mammograms and to check themselves and to see their plastic surgeon or another doctor experienced in examining the breast and examining a breast with a breast implant in it at least once a year, of course. So that's very important that these women are followed. So when I see a woman with a capsular contracture and she's bothered by it, I'll ask her, when was her last mammogram? Are there any other lumps? Does she have any other problems? Are there lymph nodes palpable in her axilla or armpit? So that's the first step. If a woman has a leaking or ruptured silicone breast implant, I think it's quite important that she look at her calendar and she pick out a time in her calendar when she can take it easy for 3 days and 3 nights, and we schedule an operation. Typically, I will schedule a capsulectomy and an implant exchange. So capsulectomy is an operation that we do where we go through an incision. Typically, it's the same incision that was made when her breast implants were put in. An incision is made, I go down through the normal tissue and I find the capsule, which can be easily found. And then a capsulectomy is performed where there's a very careful dissection totally and circumferentially around that scar. So we remove the entire scar. I remove any free silicone that I can see or feel. The breast implant is removed. The silicone shell is removed. The silicone gel is removed. And we very meticulously and thoroughly clean out that area, wash it out, and wash it out again, oftentimes with antiseptic fluid and sterile saline. If there's an unusual mass or a lump, I will do a lumpectomy or breast biopsy. But in any case, a woman with a leaking silicone breast implant, I recommend, has a capsulectomy. That's when I take out the scar tissue, I take out the leaking silicone implant, any silicone I can see or feel. Is it an emergency? No, it's certainly not an emergency. But I don't think that a leaking breast implant is very good for the local tissue. There's no evidence that leaking silicone will cause rheumatoid arthritis or lupus or any of those constitutional illnesses. But I don't think it's very good for the local breast tissue. The breast can act as a kind of sponge, and especially if the silicone gets outside the capsule, the breast tissue starts to absorb the free silicone. It can go to the lymph nodes. Diagnosis of lumps and distinguishing lumps from a siliconoma or a bad lump can be very difficult. It can interfere with a mammogram, etc. So when I see a woman with a capsular contracture and a leaking silicone implant, I advise her to look at her calendar, pick out a 3-day period where she can rest and take it easy following a capsulectomy and implant exchange. Now, when I say implant exchange, I will typically put in a new, modern silicone implant, or a woman has a choice to have a saline implant placed. Now, the newer silicone implants have a far lower rate of capsular contracture than the older, or for example, the 20-year-old silicone breast implants. As much as 30% or more of women who got the older silicone breast implants placed got a capsular contracture. Now it's more like 7% with the modern techniques. We used to tell women that silicone implants had a higher capsular contracture rate than saline implants. I don't think that's true. They're both about 7%. What else can we do? As I said, we use antiseptic fluid. We certainly use sterile gloves, sterile technique, sterile drapes, lots of antiseptic and betadine. My patients all get intravenous broad-spectrum antibiotics before the operation starts. Meticulous hemostasis, in other words, we don't allow bleeding inside. So we do anything that we know, anything that is scientifically based or scientifically founded or has a foundation in science to lower the incidence of a recurrent capsular contracture. Now, it's of course necessary that all women know if you have a capsular contracture, you may get another one. For some reason, some women seem to be sort of sensitized to the silicone shell, even the newer type, and they're more likely to get a capsular contracture. In other words, that normal scar tissue around the implant may contract and get thick and heavy again. So, some other things that we can try: antioxidants can be helpful, anti-inflammatory agents can be helpful. There is some data that indicates an accolate or Singulair, some of this reactive airway disease medicine for asthma. As I said, Singulair or accolate, some of that, there is some data that may help. There is some data that it doesn't help, or in rare cases may be damaging to the liver, but that's another thing that we can try. Sometimes if we feel that a woman is colonized by certain bacteria, staph or another bacteria, she can go on antibiotics at the time of a capsulectomy, and that may help. But the things that we do certainly know that help are the measures that I mentioned: intravenous antibiotics, thorough washout at the time of an operation, sterile technique, atraumatic technique. We're very gentle with the tissues, we don't allow bleeding, etc. So the newer silicone implants have a much lower incidence of capsular contracture. Now, what else can I offer to women? There's something called a site change operation. For example, instead of putting an implant back in the same pocket where the prior implant was placed, we can oftentimes change position. In other words, go under the muscle or above the muscle. Typically, a woman with an implant under the muscle will have a lower incidence of a clinically apparent capsular contracture. Of course, keep in mind that the ducts and lobules go only within the breast tissue and can contact an implant that's above the muscle, but it does not contact certainly the space or the potential space under the pectoralis muscle. That may be an answer. There's also some research being done into acellular dermal matrix. There are a number of companies, LifeCell, Allergan, etc., that are making a product. It's like an artificial dermis, or it's actually a devitalized dermis where all the cells are removed from it. Now, it's been demonstrated, at least in early trials, that a capsular contracture will not recur under a sheet of acellular dermal matrix. So, for the woman with a recalcitrant or recurrent capsular contracture that's really bothersome to her, that may be one answer. Of course, for the most severe cases, recalcitrant, symptomatic, very difficult capsular contracture, there are other things we can do to replace the volume, such as using a woman's own tissue. We can do the tummy tuck flap, the so-called tram flap. It's almost like breast reconstruction. We can sometimes use the latissimus muscles, but those autogenous tissue operations to replace volume are really reserved for breast reconstruction and perhaps the most severe cases of recalcitrant or recurrent capsular contracture. Most women will do quite well with a capsulectomy, removal of any silicone that we can see or feel, removing the old implants and replacing with a new silicone gel implant or even a saline implant. And the woman has a decision to make. It's a rather personal decision. There are certainly differences between silicone and saline, and typically I can talk about the differences in consultation with a woman. I mentioned a site change operation. It's possible to move the pocket or where the pocket is that's holding the breast implant above or below. And finally, we mentioned acellular dermal matrix. Acellular dermal matrix is a sheet of devitalized dermis that can be placed over a breast implant under the skin, and at least in the early stages it's been demonstrated that the capsular contracture does not recur under that acellular dermal matrix. We mentioned antibiotics. I briefly mentioned accolate or Singulair, antioxidants, anti-inflammatory agents, etc. So I think these are all tools that we have in our armamentarium to treat the woman who has a capsular contracture around a silicone breast implant, whether it's done for cosmetic reasons or reconstructive reasons. If you'd like more information about capsular contracture, hard breast implants, please call the office, 831-646-8661. I'm Dr. David Morwood, or go to drmorwood.com, Morwood. Once again, I so very much appreciate you tuning in to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. Thanks so much for being here today.